Hi, it's your pharmacist Soonkie here. Today we are talking about spironolactone. Make sure you stay until the very end so you don't miss out on any essential information about taking spironolactone. Without further ado, let's rock it. Spironolactone is used for conditions like hyperaldosteronism, where there's too much aldosterone in your body, which leads to high blood pressure and low blood potassium levels. Refractory edema associated with hyperaldosteronism, such as cirrhosis of the liver. Refractory edema means fluid retention in the body that does not respond to dietary sodium restriction and combined water pill treatment. Cirrhosis of the liver means irreversible scarring of the liver. Add-on treatment for resistant hypertension, with blood pressure that remains above goal despite already using 3 antihypertensive agents from different drug class. Heart failure, which triggers fluid retention. Hirsutism in females. Hirsutism is a condition of unwanted male pattern hair growth in women. Hormonal acne. Female pattern alopecia, which is female pattern hair loss. So, how does spironolactone work? For high blood pressure and in-fluid buildup, spironolactone works in your kidneys to increase the amount of urine production. This also helps to lower blood pressure. To further explain this, let me tell you a story. Before the story starts, let me introduce all our characters. Kidney is the factory. The nucleus in the kidney cells is the control center of the factory. Aldosterone is the key for the control center of the factory. Sodium is the husband. Water is the wife. Potassium is the money. Urine is the outside world of the factory. Blood vessels in the body is the other side of the factory. The rule in the story is, water, the wife, is in love with sodium, the husband. Wherever sodium goes, water will follow. And wherever water, the wife, goes, blood pressure increases. Sorry, I hope I haven't offended anyone. This is purely for illustration purposes, not meant to offend anyone. So, let's move on. Sodium is a table salt that you consume every day, and it can be found in many food, especially your processed food. It's not very healthy for you because water follows it and increases your blood pressure. Alright, now let's dive into our story. This is the kidney cells, which is our factory. This is the outside of the cell, which is urine. This is the other side of the cell, which is the blood vessels in our body. In the factory, there is a control center, which is our nucleus. When the key comes to bind with the control center, it makes husband gateways called sodium channels for the husbands to get reabsorbed back from the outside world into the body. And as the husbands come back, the wives follow. The binding of the key to the control center also triggers the manufacture of husband money exchange machines called the sodium-potassium exchange pump, where it is used to exchange for husband with money for the factory. Wherever the husbands go, the wives follow, thus increases the blood pressure of the body. So, spironolactone comes into act where it binds as the key to the control center and stops the real key from binding to the keyhole. Because it's the wrong key, the factory stops making more husband gateways and husband money exchange machines, thus stopping the kidney from taking in husbands and his wives to reduce the blood pressure of the body. While spironolactone is doing this, it retains its money, which is the potassium levels in the body. By looking at this story, we can also see how spironolactone is used to treat hyperaldosteronism, which is too much keys in the factories. Spironolactone acts as the wrong key and just would not let the right key bind to the center control, thus stopping all the effects that hyperaldosteronism will cause. Spironolactone also has anti-androgenic effects. Androgens are male hormones in the body like testosterone. Anti-androgenic effects means anti-testosterone effects. All women produce small amounts of testosterone. Women with hirsutism, which is excessive facial or body hair, hormonal acne or alopecia, female pattern hair loss, are especially sensitive to the action of testosterone. Spironolactone works by blocking androgen receptors in the cell to reduce testosterone formation, thus treating these conditions. Increased urine flow is unlikely to be a problem when spironolactone is used in these patients because aldosterone levels are not normally high in these patients. Now, before you start to take spironolactone, tell your doctor if you have any allergies to any other medicines, foods, dyes, or preservatives. Tell your doctor if you have any liver problems, kidney problems, or severe heart failure. Tell your doctor if you plan to become pregnant or breastfeed. Tell your doctor if you plan to have surgery. Tell your doctor or pharmacist if you are taking any other medicines, including any that you buy with or without a prescription from a pharmacy, supermarket, or a health food shop. Some medicines and spironolactone may interfere with each other, such as medicines used to treat high blood pressure like ACE inhibitors, diuretics, digoxin, potassium supplements, or potassium-containing salt substitutes, ammonium chloride, which is contained in some cough and cold medicines, aspirin, non-steroidal anti-inflammatory drugs, NSAIDs, regional or general anesthetics. Now, how to take spironolactone? Swallow the tablets with a glass of water, with or immediately after food. Depending on the dose and your condition, spironolactone may be taken once a day or divided into separate doses. Follow the instructions of your doctor and pharmacist. Continue taking spironolactone for as long as your doctor tells you to. The length of the treatment will depend on your condition, and it's usually taken long term. If you forget to take it, and if it is almost time for your next dose, skip the dose you missed and take your next dose when you are meant to. Otherwise, take it as soon as you remember and then go back to taking your medicines as you would normally. Do not take a double dose to make up for the dose that you missed. If you overdose, immediately call your doctor or your closest emergency department of the hospital. Things to be careful of. Be careful driving or operating machineries until you know how spironolactone affects you. This medicine may cause drowsiness or dizziness in some people. If you have any of these, do not drive, operate machineries, or do anything else that could be dangerous. Things you must do. If you're about to start on a new medication, remind your doctor or pharmacist that you are taking spironolactone. Tell any other doctors, dentists, and pharmacists who treat you that you are taking this medicine. This is especially important if you are going to receive an anesthetic agent while being treated with spironolactone. If you become pregnant while taking this medicine, tell your doctor immediately. If it is possible for you to become pregnant, you should use adequate contraception while you are taking spironolactone. Examples of adequate contraception are oral contraceptives, the pill, or intrauterine devices, also known as IUD. Stop taking spironolactone if you become pregnant or you think you may become pregnant. If you are about to have any blood test, tell your doctor that you are taking this medicine. It may interfere with the results of some tests. Keep all your doctor's appointments so that your progress can be checked. Your doctor may ask you to have blood tests to check your sodium and potassium levels and see how your kidneys are working. Things you must not do. Do not take spironolactone to treat any other complaints unless your doctor tells you to. Do not give your medicine to anyone else even if they have the same condition as you. Do not stop taking your medicine or lower the dose without checking with your doctor. Do not take potassium supplements or use salt substitutes that contain potassium. do not consume a diet rich in potassium. Dried fruits, bananas, oranges are some foods that contain high amounts of potassium. Consuming some of these foods is usually safe, but do not consume excessive amounts. If you're taking spironolactone, too much potassium can cause serious problems such as disturbance of the heart rhythm. Remember, all my medicine information are for general educational purposes only. It does not replace the need for a doctor or a physician, so please do not DIY buying medicines from an online pharmacy and treating yourself at home. It is very dangerous. Okay, I think that's all for a quick summary of spironolactone today. If I haven't covered anything that you want to know about spironolactone, please let me know down in the comments section below. Please give me a thumbs up if you find value in this video and subscribe to my channel to keep it alive so I can keep making these free videos for everyone who needs it. Comment down below about your experience with spironolactone or if you have any other questions for me about this medication, or what other medication videos you want me to make next. All the best with everything. It's singer-songwriter Pharmacist Soonkie here. Live life to the fullest. I shall see you around.